Welcome to Health Unplugged, brought to you by Lifeway Medical Diagnostic Hub. Here we discuss, we dissect important health-relating issues that matters to everyone. Today we'll be talking about a condition that affects millions of people worldwide. We're talking about kidney failure. What do you do when the kidneys stop working? What are the symptoms that are mostly ignored that can lead to kidney failure? And most importantly, what can you do to manage or prevent kidney failure? This is what we'll be discussing today. So join us as we unpack the cause, the mystery, the prevention and treatment, and everything around kidney failure. My name is Amazing Rita. I'm in the studio with Dr. Dimba Favor. Hi, Dr. Favor.
Hello, Rita.
How you doing?
I'm fine.
Happy to see you once again.
Happy to see you too.
Okay, so what for those that don't know actually, what is the function of the kidneys in our body?
Okay. The kidney has various functions. First of all, the kidney has the function of excreting waste. It's a function of the kidney to excrete waste. Then electrolytes, there's something called electrolytes, like they're forms of electrons that have various functions in the body. They have functions in the heart and in other parts of the body, the muscles. Yeah, so it's the kidney's function to actually balance this electrolyte, so it will not be excess or lower than normal. Yes. The another function of the kidney is for fluid balance.
Okay.
Yes, that's why one of the ways it balances fluid is by making urine. Another function of the kidney is for BP control, BP regulation. Yes, the kidney helps with blood pressure regulation. Then the kidney has other functions like production of hormones. Erythropoietin. Erythropoietin is like the substrate for production of red blood cells.
Okay.
Yes, so kidney is what produces it. Then kidney also has a function of converting vitamin D to its active form. Vitamin D is produced in its inactive form. So the kidney is the one that converts it to its active form. So these are some functions of the kidney. Yeah.
The kidney sure does a lot.
Exactly.
Okay, so what then is kidney failure?
Okay. Kidney failure is just like, I'll say it's just like an English word. When the kidney fails to carry out its responsibilities. When it's not
responsibilities.
Exactly. It's not like it would, failure is just like an English word.
Yes,
it has failed. It can't do its function. So everything, in all these things I listed, when the kidney stops carrying them out, the kidney is said to have failed.
Is it different from kidney disease?
Kidney disease is different from kidney failure in the sense that kidney disease progresses to failure. Yes. But failure is when it does not need to progress to anything again. It has stopped. It can't carry out its function again.
Okay. So tell me, this kidney failure, does this happen all of a sudden or it happens over time?
Okay, kidney failure happens all of a sudden, is abrupt, is rapid. It starts from kidney disease. Okay, in fact, it starts from kidney injury, aka acute kidney injury. It progresses to acute kidney disease, progresses to chronic kidney disease, then it progresses to end-stage renal disease, then kidney failure. So kidney failure is like, for the word failure in itself, like it has failed. But it does not like it progresses. But when you say kidney failure, it means the kidney has failed. Yeah.
But it took time for it to get to that point.
Exactly.
Okay. All right. So what would you say is the leading cause of kidney failure?
Okay. There's no particular thing in itself that is the leading cause of kidney failure, but then there are things that could cause, hypertension is a very, very strong risk factor for kidney failure. Diabetes is a strong risk factor for kidney failure. Obesity, this obesity we keep talking of all the time, exactly, is also a strong risk factor. Then some people have autoimmune disease. What do I mean by autoimmune disease? Autoimmune disease is where the immune system is fighting itself. Exactly. Like now, immune system of Mr. A is fighting itself. Yes. So some things like SLA, Lupus erythematosus. It's a form of autoimmune disease. It comes with kidney disease.
Okay.
Exactly. Some people could have malignancies, cancers, which kidney failure is a component of. Example, multiple myeloma. Multiple people having multiple myeloma, they have kidney failure as one of the components. Then some people could just be born with kidney issues, like somebody having autosomal polycystic kidney disease. That person is born with it. Some people could be born with just one kidney. Yeah, some people could have renal cell carcinoma. So all these things are causes of kidney failure. Like when they progress, they could get to kidney failure. Yeah.
Wow. Tell us how high blood pressure affects or causes kidney failure.
Okay, first of all,
We're always talking about it like it being silent killer, and there are people that are suffering from high blood pressure and they are still stubborn about it, like going to check their blood pressure, make sure that they do everything to make sure their blood pressure is being regulated, avoiding things that can trigger it and the rest. So how can high blood pressure cause kidney failure?
Okay, for high blood pressure causing kidney failure, majorly it affects the glomerulus. Glomerulus is part of the kidney that helps in filtration.
Okay.
Yes. So majorly high blood pressure affects the glomerulus. Another way it can cause kidney failure is that it affects the blood vessels. And then when the blood vessels are affected, there will be, okay, let me paint a picture now. Yes. Let me assume someone having hypertension, the blood vessels, maybe it gets to a point where it ruptures or it gets weak, or just something happening to the blood vessels that supplies the kidney. Yes, the kidney will start undergoing necrosis. That itself, it will not be getting enough blood supply. Yes, and it will start undergoing necrosis. Normally, the kidney, we have the cortex before the medulla. The cortex is the outer part covering it. So most times when there's insufficient blood to the kidney, the cortex gets blood, but the medulla, the inner part, is the part that undergoes necrosis most of the time, because the blood will first supply the outermost part before coming in to supply the inner part. And then in a case where there's no sufficient blood coming to the kidney, just that outer part will get blood, while the medulla and other parts will undergo necrosis. That way you can see the kidney is dying off. Secondly, the blood vessels, they'll be affected, and then filtration cannot take place. So even when blood comes there, it cannot be filtered to produce urine. So this will lead to accumulation of toxins. Remember, I said one of the main functions of the kidney is to filter waste.
All right. Are there signs? You say signs is what the patient sees, symptom is what the doctor.
The opposite.
Okay.
Turn it the other way.
Symptom is what the patient sees.
Exactly.
Okay. You said symptom is what the patient sees, and then signs
is what the doctor elicits.
Okay.
Yes.
So are there symptoms of kidney failure?
Yes, there are. Okay, some things like someone could just stay and maybe the person comes to the doctor and says, doctor, I'm now urinating excessively. I know in our contemporary world, in our society, once someone tells you I'm urinating excessively, the first place your mind goes to is sugar. Diabetes, yes. But then excessive urinating is one of the symptoms someone having kidney issues can come down with. Yes, that's called frequency in medical terms. Another thing is this, frothy urine. Frothy urine is like when someone urinates and then the urine is very foamy, and then the foam takes so long before it clears out. Yes, so that's frothy urine. It's just indicating,
like when you pour alcohol on the ground.
Exactly, or detergent water. That's frothy urine. It's just telling you that this person is losing proteins in urine. That's what's giving rise to that frothiness in urine. Exactly. And it's only a kidney that is getting bad that will allow proteins to be lost in urine. Like for someone whose kidney is still functioning properly, there is usually minimal or insignificant loss of protein. But then when the urine starts getting frothy, that's foamy, it means that there's significant loss of protein. Another thing you could see is hematuria.
Okay.
Hematuria is blood in urine.
Okay.
And there are different types of hematuria. You have total hematuria. You have the hematuria where you see blood in the urine. You first see blood before you now see urine. You have the type where you see blood totally, like the whole urine will be bloody. You have the one where urine will come out and then towards the end is now blood. So hematuria is another thing, another symptom. The patient can come to the hospital and tell the doctor, I've been seeing blood in my urine. That's another thing you can see that can tell you something is actually going wrong with the kidney. Yes, sometimes if it progresses, you could see swelling. Yes, the person usually there are 3 systems in the body. When you see swelling, maybe on the legs, the face, the stomach, there are 3 systems in the body you should check out for. The renal, that's the kidney, the cardiovascular, that's the heart, and then the gastrointestinal system, that's majorly the liver.
Okay.
So whenever you see swelling, you check out for symptoms in these 3 systems. But then the one that comes with swelling both in the legs and on the face is usually pointing to the kidney, telling you that something is wrong with the kidney. Then if it further progresses, this person can start coming down with vomit, nausea. Nausea is just like the feeling to vomit, and then vomiting, sometimes hiccups. Before you know it, this person is coming down with encephalopathy, but that's when the kidney disease is very bad. It has gotten bad, yes.
So this kidney disease what we're talking about, can children, young adults, teenagers, like especially children and teenagers, can they suffer from kidney failure?
Of course they can. And how is it possible? Remember I told you when we're discussing risk factors, I told you some people can be born with kidney issues. Yes, something like the autosomal polycystic kidney disease. A child can be born with that. Another thing is that a young adult, can equally have the autoimmune disease like SLE. Another thing is a child. Anyway, renal cell carcinoma is not so common in children or young people. But another thing, we have what is called post-streptococcal glomerulonephritis. What happens in post-streptococcal glomerulonephritis? Maybe an insect or something bites, or there's just a skin issue or sore throat, poorly treated sore throat. Yes, in the space of a month, it could affect the kidney. It can affect both young children or young people, and it can equally affect adults, though it's more common in children and young people. And then there are different organisms that can cause it. In children, it's more of streptococcus, but in adults, it's more of staphylococcus that causes it. So you can see if this strep affects a child or a young person, person can still come down with kidney issues. Another thing is this dehydration. Most times we see a lot of babies, young children vomiting, stooling. If nothing is done about it, dehydration is one of the things that can cause kidney issues. Exactly. So a child, a young person, an adult, an elderly person,
anybody
can come down with kidney disease.
So Dr. Figo, I've seen people being taken to the hospital and then they are diagnosed with end-stage renal disease. You know, like the kidney is shutting down. And before they are trying to do 1 or 2 things together, the person just gives up the fight. But why is it that most times, I don't know, but I feel it is mostly diagnosed at the end stage, like it's diagnosed late?
I think the reason is this. Like I told you, when the symptoms start, majority of patients I've seen in this card that you just described, most times they come down with, I see them when they come, most times they're presenting with leg swelling and face swelling, especially periorbital around the eyes. But then when you ask them, when you notice this, what did you do about it? Most of them tell you that I was using herbal medications. Unknown to them that herbal medications worsen it, and then in fact it helps kill the kidney faster. So most of them will tell you, I felt herbal medications could help me sort this out. Not like they knew it was kidney issues. They didn't know, they had no idea, but they felt that taking herbal medications could help. And then secondly, some of them, maybe the swelling, they'll have pain there and they go on to take painkillers.
Painkillers.
And painkillers is one of the things that affects the kidney because there's what is called prostaglandin.
Yes.
The body produces it normally, yes. But then when you take painkillers, it goes to inhibit the production of prostaglandin. And prostaglandin normally, that prostaglandin is supposed to dilate the arterioles. There's a blood vessel that supplies the kidney that is called arterioles. Do you understand? So this prostaglandin is supposed to make it wider, dilate it, so that more blood can flow into it for the kidney. But in the case where someone, maybe this person now having the leg swelling, taking herbal medications and feels like I'm experiencing pain, let me still take pain medications to help it, not knowing that he's worsening it, because when he takes the pain medication, it will cut or shut down the production of that prostaglandin, and then this will now make the blood vessel that is supplying the kidney, it will make it smaller in size instead of exactly, thereby further reducing the amount of blood that goes to it. And remember, it's the amount of blood that goes there that gets filtered, and then the waste is sent out, including excess fluid. So I think this is a reason why people now present very late, and by the time you could do one or two things, they've given up.
It's already late. Wow. Then how, with all the signs that you've shown us, the symptoms rather that you've shown us, and the signs the doctor would see and everything, how is kidney failure diagnosed?
Okay, like I said, when you see swelling in any part of the body, usually the face, the stomach, the legs, there are 3 systems you're looking out for. The renal, cardiovascular, and then you're also checking out the liver. Because these 3 systems can give you swelling. So first of all, to make diagnosis of a kidney failure, yes, your history taking is very, very important. History taking can give you about 70% of the diagnosis. Yes, in your history taking, you're trying to find out, is there any time you had anything like a skin rash? Is there any time you had anything like a sore throat that was poorly treated? Because like I said, post-streptococcal glomerulonephritis, yes. You also want to find out, does this person abuse NSAIDs, painkillers? Do you take alcohol? Do you take herbal medications? Do you have family history of cancers? Yes.
Kidney problem. Is it hereditary?
Okay, let me just get done with this. Yes. Do you have family history of cancers? You want to also find out if this patient has any autoimmune disease. All those risk factors, you want to rule them out. If the person is a known hypertensive, how well do you control your blood pressure? So by the time you're done getting all this history, taking this history, you can do your examination. Give me a second. In your history taking, don't forget to ask the patient, this swelling, when it starts, is it worse in the morning? Because the one that comes with kidney issues is usually more of periorbital around the eye, and then it's worse in the morning. And then as the day goes by, it reduces. Exactly. So in your examination, you want to elicit flank tenderness. You want to check if there's anything like flank pain, because kidney stones usually cause flank pain. You also want to check for anemia, because like I said, the kidney produces erythropoietin, which is like the raw material needed to produce red blood cells. So you want to check for anemia. Is this patient anemic? And then you now further send for investigations. The investigations you're sending for, you want to do your serum, electrolyte, urea, and creatinine. The electrolyte, remember I told you one of the functions of the kidney is electrolyte balance. So if the electrolytes are not falling within the normal range, there is an issue. If the urea is higher than normal, the kidney is not excreting it. If the creatinine is higher than normal, you also know there is an issue with the kidney. You could go ahead to do some imaging studies. You can do a scan to check the shape, to check the kidney. Exactly. You can do a CT, you can do an MRI. So these things will help you make the diagnosis.
So back to my question, is it hereditary?
I would say yes, there's family history is a risk factor. Exactly. For someone now who has family history of cancers, is you won't be surprised hearing that this patient has renal cell carcinoma.
Okay.
For someone who has family history of autosomal polycystic kidney disease, you won't be surprised hearing that this patient has it. So for someone who has family history of hypertension, hypertension is a serious risk factor for kidney disease. So family history, hereditary has a role to play in kidney disease.
So you've talked about dehydration, you talked about high
Yes.
blood pressure, diabetes, and how they affect our kidneys. Are there some food, the food we eat every day, that can affect our kidney health?
Okay, yes, there are. Like our sodium intake, salt intake. Salt has a very serious role to play in hypertension. Like I said, hypertension is a huge risk factor for kidney disease, exactly. So, you know, wherever sodium goes, water goes
Yes,
with it.
yes.
Exactly. So salt is one daily intake that plays a role in kidney issues. Then processed foods, because what do processed foods do? Those of them that have high fatty content, they leave deposits on the walls of the blood vessels, thereby narrowing the space. Then red meat, alcohol. Yes, these are things that have roles to play in the health of the kidney.
What about herbal drugs?
Of course, herbal drugs, I would say they are more harmful than good, than helpful to the kidneys.
So what of over-the-counter medication? You mentioned NSAID.
Yes.
You know, people going to get drug without doctor's prescription just because maybe they're feeling pain or they feel this symptom or another. Can it, in long run, affect the kidney?
Of course, some over-the-counter medications can affect the kidney. Example, just like the NSAIDs I told you about, all these painkillers, ibuprofen, and the rest. They go to block the production of prostaglandin, which is very helpful in the kidney. So some over-the-counter medications can affect the kidney.
Okay, so let me ask.
Okay.
As the kidney is shutting down, like the kidney is gradually failing.
Yes.
It's not yet. It has not failed. Are there some of the organs it will be affecting?
Of course, there are. Like when I was describing or listing out the functions of the kidney,
Yes.
I said fluid regulation. Yes. So imagine a case now where the kidney is no longer working well. This person is no longer making enough urine. So you know that the fluid will be accumulating in the body. So this fluid would go back to the circulation and go back to the heart to cause fluid overload. So that way it could affect the heart. Another system it can affect the brain. Remember I said the kidney is responsible for excreting toxins, waste products. So in a situation where these toxins are not excreted,
don't go out,
exactly, they pile up and then they go into the circulation. It could go to the brain. And that's why you can see when some people come down with kidney failure or end-stage renal disease or CKD, chronic kidney disease. Some of them, they'll be talking irrationally. They'll be saying things that you're not even understanding. Yes. And when it gets to the brain, it can cause irrational talk. It can even cause seizures. Some of them will start having seizures. Another organ it can equally affect the blood vessels, because I said the kidney is responsible for maintaining or regulating blood pressure. So in a situation where it's not able to carry out its function, it would affect the blood vessels as well. Also, remember I said the kidney is responsible for production of erythropoietin.
Yes.
Erythropoietin is like the precursor, is like the raw material for production of red blood cells. Yes. So in a situation where the kidney is faulty or failing or has failed, and then it can't produce erythropoietin anymore, this patient will be anemic. And you know, red blood cells, they are very important because they are one of the components of the blood. So generally, this person will be affected.
So early stage of kidney failure, can it be reversed?
It depends.
Okay.
It depends on how far or how bad it has gone. For example, someone who is tilting towards, someone that comes down with acute kidney injury secondary to dehydration, from dehydration, if you rehydrate
Hydrate
this
person,
person properly, the kidney can pick up.
Feedback.
There are some people, after undergoing dialysis for first 2 or 3 sessions, the kidney can pick up. So like I said, it just depends on the extent of injury or damage to the kidney.
Okay, you just mentioned dialysis. Let's talk about
Yes.
dialysis.
Okay. Dialysis, I'll just say
How can it help when it comes to
Okay.
the kidney and getting bad?
Okay. I'll just say dialysis is I'll just put it in a layman's term, is an external type of kidney.
Okay.
Yes. Now, when the kidney is unable to excrete waste, regulate the electrolytes, excrete fluid, dialysis is a machine, is a form of external kidney that can help do these things. It can purify the blood from the waste, take out excessive fluid, and then just like that. So
Is that the only treatment that is available for people that are their kidneys are almost failing?
Dialysis is one of them.
Okay, one of
but
them.
then renal replacement therapy comprises of 2 things, either dialysis or renal transplant. That's kidney transplant. So in a case where dialysis has failed, kidney transplant would now be the mainstay.
Okay, for someone who has started dialysis, how many times are we looking at?
Okay, generally you cannot do dialysis every day.
Okay.
Yes, most times it's safe to do dialysis every other day, alternate days. So in a week, if you're doing dialysis every other day, it should be like 3 times a week. It's okay for dialysis 3 times in a week.
Okay, 3 times in a week.
Yes.
So while doing the dialysis, are there some modifications you have to do, or you can just be living your life normal?
Okay, I think there are some modifications.
Okay.
Yes. First of all, you know that you can't just be living anyhow. So you have to do dietary modifications. Like we said, the salt or sodium intake. If you take alcohol, you have to cut down on it. If you take herbal medications, if you take processed foods, you have to cut down on all those things that worsen the kidney injury or kidney problem. Then secondly, you must have to be very, very, very mindful of your antihypertensives if the person is a hypertensive patient.
Okay.
But most times, the majority of cases, people who have gotten to end-stage renal disease or chronic kidney disease, most of them have hypertensive issues. Yes, so they must be very, 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 very compliant with their medications. Then the person can live his normal life, but not fully.
Okay.
Because at this point, the person will always be careful.
Yes.
And then the person will always have to remember that next tomorrow I have to go for another session of dialysis. So just in case the person maybe is someone that walks daily, you can see that this will now be impinging on the daily routine. So that's it.
Okay. What are the chances of the kidney going back to full recovery when the person is on dialysis?
Okay, like I said, it depends on the extent of the injury to the kidney. Yes, there are some people after first 2 or first 3 sessions of dialysis, the kidney picks up. But like I said, it all depends on the extent of injury to the kidney. Yes.
Are there some side effects of dialysis?
Yes, there are. Sometimes people who undergo dialysis, sometimes it has a way of playing back on the blood pressure.
Oh, okay.
Yes, sometimes even after dialysis, the blood pressure remains recalcitrant. That is still very elevated.
Okay.
And then because the dialyzing machine, I told you, is like an external kidney. It's like a mimic of the normal kidneys. Yes. So sometimes it can over extract electrolytes, and then this person will now come down with electrolyte imbalance. Then you now have to start finding artificial means to adjust the electrolytes. So there are 1 or 2 side effects. Yes, sometimes infections, because this like now like I said, a dialyzing machine is like an external form of kidney. So it's purifying the blood. So this blood could get infected. And then most times, remember I said, someone having kidney issues, the kidney is no longer producing erythropoietin.
Yes,
So in the course of dialyzing them, sometimes you may need to give them blood. So in a case, imagine if it's an emergency and then one or two hazards or carelessness, and then an infected blood is transfused to this person. So these are just some hazards that can arise from dialysis.
Okay, before we round up on this, why for a kidney that has failed and probably the family or the person was able to do a kidney transplant, and probably the two kidneys, is there a possibility of that person living on one kidney?
Yes, like I said, some people are just born with one kidney, and then that one kidney can carry them through life.
Okay.
Yes, even when you want to do a kidney transplant, sometimes they use a living donor. The person will donate one of his kidneys or her kidneys and then live on one. So one kidney can do the function of the two kidneys perfectly well. It's just that, yes, it's very possible. Yes.
So, but you have to be careful.
Exactly.
Because anything that happens to that one,
that's all.
Oh my God. All right, so let me ask you this question. How do you manage or how do you prevent? Sorry, how do you prevent, like we trying to live a healthy life? What are the things that we can do to make sure that our kidneys are healthy? We don't get kidney infection, disease, or probably kidney failure.
Okay, first of all, we should learn to stay hydrated at all times. Take a lot of water because the kidney needs a lot of water. Secondly, all those things we discussed, those foods that are not so healthy, we should cut down on them. Then for someone that is a known hypertensive, person should make sure he or she controls her blood pressure. Then obesity, we must make sure we keep healthy weights. Don't be extremely big or sedentary lifestyle. You know, it has a role in causing someone to be obese. So all these things, and then excessive painkillers, abusing drugs, medications, painkillers, we should avoid them. Then whenever you have an issue, make sure you see the doctor. Don't wait for it to progress, or don't go to the herbalist and then when it gets worse, it's now when you come to see the doctor. Then finally, some people may have a sore throat or a skin infection and just overlook it. But then it has a role to play in affecting the kidney. So whenever there are issues like that, the people, they should make sure they see the doctor.
All right. Thank you so much, Dr. Favor. It has been an interesting one. And today we talked about kidney failure and everything, the myths and the symptoms, the signs, and how we can diagnose kidney failure. And also, let's not forget that it's not like a death sentence. It just depends on quick action, you know, and you not overlooking things. When something happens to you, you just be like, okay, because I remember there was a case we had here at Lifeway. There was a patient and she had kidney disease, bilateral, the two of them, and it was diagnosed early. And I was even, when I saw the patient crying, and I even walked up to her and asked her what the problem. I was trying to console her and tell her, thank God it was diagnosed as at this point. You can actually do something about it. But when I was asking, because I only see the friend like a couple of times after then, I was asking the friend, how is this person? How is this person? And she said they didn't go to, they went to the hospital. From there they left. They said they should go and do herbal. And guess what? They lost that girl.
Oh, that's so bad.
It was so painful. And when she told me, I screamed because I knew if it was managed well on time, it wouldn't have
it wouldn't have gotten that bad.
It wouldn't have gotten that bad. She wouldn't have lost her life to it. So,
and another thing, like when you give patients appointments for their dialysis, some of them intentionally or I don't know, out of negligence decide to ignore the next appointment, and then that way the creatinine will further pile up, still breaking the kidney down
my
again.
Body's still light. Let me wait. You know, like, I've seen patients even say, I don't think I will come today. My body's still light. You don't know what's actually happening inside your body. So please take care of your health. Take care of your kidneys. They're very, very important. You see, they are just two being like something in your body. They are doing wonders by itself. And just a problem to the kidney affects the system, affects other organs also. So please take care of your kidneys. And we will see you next time. Thank you for sticking around with us. My name is Amazing Reader.
And I'm Dr. Dimba Favor.
So till we see you next time, please stay well and stay healthy.
Bye.
Bye.